Hi, it's David Shaughnessy here, the EMEA Healthcare Practice Lead for Avaya. I'm at the wonderful Eutech 2016 show, and I'm with Kedar and Mac from GSLab. They've been doing some great collaboration on the Avaya Breeze platform and the client SDK. They're going to tell us about some of the demos and some of the features that they've actually developed using the client SDK and the Breeze platform, specifically in healthcare. Guys, can you give us a context of what actual demos you've created or what apps you've created?
Sure. So thanks, Dave, for the introduction. Like you have already mentioned, we have built apps especially for healthcare which are using CSDK, the client SDK for Android, and also the Breeze platform. So here, as you can see, we have set of simple devices and we have simulated scenarios which target healthcare engagement for patients from a remote location. That kind of engagement can be checking your vital signs from a wearable device, be it your blood pressure, be it your pulse rate, or creating a conference in an emergency situation. So what we'll do is we'll just quickly go over the devices and we'll create an instant conference where a patient undergoing emergency can reach out to his doctor, his relative, without touching the phone. So let's go over here. We have three simple use cases. One, let's say a patient who has suffered a stroke can just shout and the event can be captured. A camera monitoring the patient can also capture the pain of the patient or the fall of the patient. Or the third use case can be the wearable can detect the fall of the patient using the sensors inbuilt in it. So let's just demo the first one.
This here we're trying to say, we're talking about the patient app. This is where the patient app is. Now, the first use case that we're talking about is when the patient is in pain and he wants to shout out for help.
Yeah.
Let's go ahead with that.
Help me. So as you can see, only shouting has created the Avaya Scopia conference where the patient is automatically dialed in. That's the beauty of this thing. Similar triggers can be fired from any kind of device that you can imagine. We'll try the facial expression one.
Okay, I have to make this is going to be really embarrassing because I have to make a really painful face, which I know a lot of my friends will say is pretty standard for me, but I don't. So let's see.
That's the photo. Let's analyze if it's painful enough.
Is it painful enough? It looks pretty painful. It looks pretty embarrassing. That's what it is.
It is.
Bingo.
It worked. That's cool. And the last one is about simulating a fall. So here we are doing a collab which creates a noise which can be captured. So for example, so again it triggered a conference. So these are only the, let's say, classic emergency situations, but the story goes beyond these emergency situations and it's mainly covering all engagement with the patient from all perspectives. Is that?
Yeah, and I think what's really vital here for people to understand is they've taken some triggers in terms of the clap, the facial recognition, which I think is fantastic, the noises, the sensors, etc. They've taken those triggers, captured them, and they've fed them into a Breeze process. That Breeze process then lights up a light, creates a conference, notifies certain people, does some action.
Yeah.
So that's the combination of the application, GSLab, Breeze, and then whatever the customer wants to do is really up to their imagination, up to their process. So I think it's a fantastic combination. Guys, I think this is really, really a good example of a simple use of some technology that GSLab have done together with Avaya, the Breeze platform, specifically in healthcare. Guys, thanks very much for this.
Thank you, Dave.